Good.
No, it's hot, man. It's hot.
Right.
Knock on the door. This is an unconscious resident, okay? So even though they're unconscious,
Dito pala ako sa tabi mo
hello,
muna.
girlie.
Unconscious
My
pala.
name is Sarah. I'm your nurse. I'm gonna give you oral care. So is that okay? So even though she didn't say anything, you still have to go to the
Talk to
nurse.
ano, yeah.
So after that, you're gonna wash your hands, and then you're gonna get your equipment. So you're gonna need basin, mouthwash, water. When they say 50-50 mix, that means if you put 10 cc's of water, you gotta put 10 cc's of mouthwash.
50-50.
You're not gonna put 50 cc's of water, 50 cc's of mouthwash because this patient is unconscious. She's gonna aspirate. So 50-50 mix only. We're talking about percentage. Okay? After that, you're gonna need 3 tutettes, lemon glycerin swabs, and also Vaseline. We're going to pretend this is Vaseline.
Okay.
And also, in the book, it tells you to use tongue depressor with gauze.
Right.
But for the Red Cross, all you have to do is just gently open the mouth. or
With the
jaw.
chin?
Yeah.
Okay.
And then after that, so you got everything, and then also gloves. Where the hell are my gloves?
That's not good for the monitor?
Oh, never mind. So, wait a minute.
He's trying to show us down there. Behind right now.
Man, this one here.
That's the latex.
Okay, don't worry, I'm gonna edit the movie. You're not gonna hear any cursing.
We're not gonna say, yeah, right, like you don't curse, huh?
You're not gonna hear
Can you
that.
edit it?
Yeah.
No, we wanna hear it all, we wanna hear it all. We wanna
Okay,
hear
so
ourselves.
after that, then, you know, you always remember to wear gloves, okay? And then don't forget your little tray. 'Cause all your equipment's gotta go there. It doesn't go in here.
Your tray,
Little tray.
put all your stuff on.
And then after that, then you're gonna have to,
2 towels.
you're gonna need at least 3 towels. One for the table, one on top of the patient's chest, one for the back of the head. Okay? So let me
The
just
head.
fix the towel first on top of the table. Okay, look how I do this. It's tricky.
If that were me, it would have slid right off the table, man.
I mean, you don't really have to do this. Man. They're not going to give you pointers if you don't do it a certain way.
Dito sa
Dalawa lang?
Okay, and then the other towel
Malilito
goes
pala
right
tayo
here in
yan.
the back.
Malilito pala tayo yan.
Okay, and then the other towel goes on top of the chest.
Sir, bakit daw dito 2 towels lang?
Believe me, man. There's always
Red,
one
that's
towel
Red
on
Cross,
the table.
okay.
You always protect the table.
Oh, yeah.
Okay, so now after that, after you did all your opening skills, and then after closing the curtain, and then obtaining the equipment. So we're gonna get ready. So we're gonna have to raise the bed to a comfortable working height, hip level, and then also you're gonna have to raise the head up to
45 degrees.
Aren't they already sitting at 45
No.
unconscious?
Well, usually it's 35. But for the actual skill, you have to tell them that you're raising the bed to 45 to 90 degrees. Okay, so we're gonna pretend this is 45 degrees. That's 45 degrees. Okay, in the book, they tell you to turn the patients on the side. But for the Red Cross, all they want you to do is turn the resident's head towards you. Okay, before you do anything else, put your gloves on. Okay, gloves. Half and half water. For example,
Half
10
mouthwash.
cc water, 10 cc mouthwash. Your basin. Right here, you have a small trash bag here. If you don't have a small trash bag, there's a small trash can on the side of the the bed. Okay, and then what you're gonna do next is you're gonna have to turn the resident's head towards you. Okay, after that, basin, kidney basin on
Kidney
the side
basin.
right here, and then gently open the mouth. There, gently open the mouth. There. Okay. So let's pretend that she's already opened her mouth, and then the basin is on the side of the head, and she's facing towards me. The reason why the resident's head is facing towards you so that you can see if the patient is swallowing the water or if they're aspirating. Because if they're facing not towards you, then you can see it. So again, number one tutettes, soak, rinse off excess mouthwash, and then after that, after rinsing off, after squeezing the excess mouthwash, then you're gonna clean. First thing you gotta clean the teeth. Okay, teeth. One. Okay, up and down, side to side. After cleaning the teeth, then you discard this one. So throw it in the trash or put it right here. But usually throw it in the trash. Number 2, soak, squeeze, and then remove the excess. The gums, up, and then lower part of the gums. And then after that, throw this away.
Throw it away.
Number 3,
For the tongue.
roof of the mouth. Wait a minute. So soak, squeeze,
Squeeze.
roof of the mouth, and then tongue. Circular motion tongue. And then after that, throw this, and then throw that out. And then also, after the two tests, you're going to use the glycerin swabs. This is for added flavor so that the patient can taste the food. It's usually, besides cleaning, it also moistens the mucous membrane. So again, there's like 3 swabs. So number 3 is for the gums. The first one is for the gums. Throw. Number 2 is for the tongue. Throw. The third one is for the lips. Okay? So again, this acts as a container, just in case the patient throws up or so she don't aspirate. Okay, so after we're done, we're gonna put Vaseline on your fingers, put it on the lips. Okay, now we're done. So we're done with the Vaseline. We're gonna have to clean the excess Vaseline. Okay.
Wipe.
After that, the resident's head, put it right
Straight.
there, straight. And then
Put the
before
bed.
that, let's remove the towel, right here. And then we're gonna have to position the patient back to her original position. If she was on 35 degrees, then put her back to 35 degrees. Never put them flat because they're unconscious, chances are they might aspirate. So again, 35 degrees. After that, then do your closing skills. Remove all the equipment used. Take off the gloves. Wash your hands again for 60 seconds. Don't forget, you wash your hands before and after.
Mm-hmm.
So after washing your hands, then you would lower the bed to its original position or the lowest position. Call out within reach even though the patient is unconscious. Open the curtain. Even though they can't hear you, still go to asking them if they need anything else. Let you know. Report and document. Cut.